Hi, I'm Dr. Richard Brownlee. I'm a neurosurgeon in Kamloops, and I run the Welcome Back MRI and Pain Management Center, which is a private healthcare facility. So today I wanted to talk a bit about what private healthcare is and whether we should have it. In Canada, we have what's called the public healthcare system, and it is how it works is defined by the Canada Health Act, which was implemented in 1984. And basically what it says is that everybody has equal access to all essential medical services, which means all services that are provided by physicians in doctors' offices or within the hospitals. So if you need a consult with a specialist, that's covered. And physicians are paid on what's called a fee-for-service basis. So it's good for physicians because they don't have to worry about not getting paid. If they see somebody, the government automatically pays them a set fee for consults and for surgical procedures. So it's actually a good system for me and all the other physicians. The amount you get paid is a bit variable because each province has their own healthcare system that they negotiate reimbursement through the government. And then the federal government provides some additional funding to the provinces to help pay for healthcare. The problem with our healthcare system is that it's really underfunded. So people end up waiting on wait lists for very prolonged periods of time. If you have an emergent or an urgent problem like cancer or heart attack or you're involved in a car accident, then people are treated in a good period of time and they're treated very well. If you have what's called an elective problem, such as chronic pain, like the people we see at the private clinic, that system is really underfunded, and people can literally wait for months or years to be seen by a specialist or to have surgery for that type of problem. And that's where private healthcare comes into effect. So people can get what's called expedited treatment. They get seen sooner in a private facility than they do in a public facility if they have either extended health that'll pay for it or if they pay privately. Right now, providing private health care for what is deemed essential services, even these elective systems, is against the Canada Health Act, and technically we're not allowed to do that. But if we don't, then people end up waiting for a long period of time, and there are a lot of people that are willing and able to pay for private health care because they don't want to wait for years to go out and enjoy their holidays or go back to work or enjoy the retirement. So my opinion is that we should have a private healthcare system, and I don't think that that has any negative impact on the public healthcare system. I think our public healthcare system works very well for essential services that are urgent or emergent, but it works very poorly for essential services that are deemed to be elective. And having a private healthcare system that gives the people the opportunity to pay for services if they want to enhances our public system because it takes people off the long wait list and it gets people back to work, back to enjoying their life. The way it is right now, people wait such a long time, they end up addicted to narcotics, they end up with chronic pain conditions that never get better. So I would encourage people to really look at our public health care system and our private health care system, and personally I think we need to have both. Canada is one of the very few countries in the world that don't have a blended system of both private and health care. They always compare us to the American system, which is a very poor system. They spend the most on health care because they have many insurers that compete for the dollar. They're all a for-profit organization, whereas countries like Australia, New Zealand, France all have blended systems that actually work very well. And I think that Canada should look at implementing a similar type of system. So if you agree with that, then talk to your MLA and look at having healthcare as a topic for the next election, both federally and provincially. I'll be back to give more information at another talk sometime in the near future, so stay tuned.